Welcome to The Planet Forward with Preetha. Conversations for a greener future. The place where we ignite discussions and uncover innovations driving us towards sustainability. Every episode, join your host Preetha as we explore the stories, ideas, and pioneers making a real difference in our world. Get ready to be inspired, learn, and be a part of the change that propels us forward to a greener tomorrow.
Welcome back to another episode of Planet Forward with Preetha, Conversations for a Greener Future. Today, we have the privilege of speaking with Dr. Lakshmi Sankaran, a distinguished mental health practitioner and the Deputy Director at the Banyan Academy for Leadership in Mental Health, commonly known as BALM. Dr. Sankaran is an alumna of Tata Institute of Social Sciences and brings a wealth of experience from her extensive career in academia, research, and applied psychology. With over 2 decades of dedicated service, she has contributed profoundly to advancing mental health practices, focusing on family therapy, addiction, gender-based violence, and substance use. Her work goes beyond traditional therapy. She is deeply involved in designing and implementing innovative approaches to mental health that combine clinical expertise with compassionate care. Dr. Lakshmi's commitment to ethical practice and her passion for art-based therapy have made significant impacts, not just within BALM, but across a broader mental health community. Today, we are excited to dive deep into her journey, the challenges she's faced, the innovations she's spearheaded, and her vision for the future of mental health care. Dr. Lakshmi, welcome to the show. I'm so happy to have you today with me.
Thank you. Thank you so much, Preetha, for inviting me, and I'll do my best.
Oh, I'm sure it's going to be an amazing conversations today. So as I was preparing for the interview today, I was looking through all the work you've done, and based on the bio which was given to me, I was so curious to know something is like the driving passion, right? Because this work, whatever you've been doing in Banyan, it has to come with a purpose and passion. Only then you can give your everything to do such a work. So I want to ask you, like, Dr. Lakshmi, you've dedicated much of your professional life to researching mental health and social work. Could you share what initially ignited this passion within you, and how has it evolved as you encountered different challenges and successes in your career?
I just to put it very simply, Preetha, it is for me. It was a bit offbeat to look at mental health. As you know, not many of us. It was not very popular. You either did commerce or economics, which I
Yes.
did, and move into the regular streams. And social work is considered a bit, what's it about, and so on. Because
Especially in the Indian community, your children are expected to either go to be a doctor or an engineer. And a third career is like virtually non-existent, at least given our times, right? Only now things are much better. So I can only imagine getting into social work would have been a totally offbeat decision.
Absolutely. And so then I sort of muddled along, and then from this moving into NIMHANS, it really opened my eyes that there's so much going on in mental health, and it was shocking, especially in public health, and how there is a lot of stigma, shame, walking into a hospital or any kind of a setting much later, because it's almost like a last resort.
Yes, you're right. Yeah. So people try to always keep it, behind the doors, even if they're going through such a mental agony because of their stress or whatever is contributing to their condition. They don't want to come out and even acknowledge that. It's considered a taboo, even today in our community.
Very much. And also, and families have, they're trying, they've done different things. It could be, speaking with relatives, friends, teachers, going to the temples, churches, mosques. There's a constant struggle using different remedies. There are ups and downs. Things work, things may not work. So when things get really difficult to manage, they come into a center. So for me, it was always, quite, it would surprise me each time, I worked with a client. It was always new,
Mhm.
and then joining the Banyan was again quite amazing and challenging because, They're moving away from, institutional, like an asylum setup. And I'm quite amazed at how, uh, while we've been in this field for 30 years, I think each day, each project is always a struggle, and it's not easy to do what the Banyan does in terms of, group homes, moving people away in a setting which is as natural as possible, an ecosystem, and so on. And it continues to fascinate me. So I think it's a very rewarding work. And I'm so glad I sort of, the fact that I'm here for more than 25 years, I think is a testimony that it's, while
It
there's
speaks,
burnout,
yeah,
yeah,
it speaks volumes about the commitment that you have and the strides you have made because of your passion in that. And you see that there is a much needed help in this sector, especially in mental awareness and also to treat them as well, right? They treat the clients or patients, however you want to call them to be. So I think the next one I want to ask you is like, uh, in your extensive work with addiction and family therapy, how have your personal experiences shaped your approach to these sensitive areas? Could you give us an example where personal insight led to a breakthrough in your professional practice? I think before the interview started, you're also talking about how you have transitioned to art-based therapy. And I would like for you to, elaborate on that also, Dilek. What made you go through this journey and realize that how you need to come up with this art-based therapy and what it entails? I'd like to go a little deeper in that.
So about addictions or dependence, I think I just got into it by sheer accident because we're exposed to different settings, and then you might say, hey, you see so much of relapse and recovery. So
Mm-hmm.
while there's treatment, there's also relapse. It's two sides of one coin,
Yes,
and
absolutely.
like all of us, we have ups and downs. Similarly,
There are
patients.
some trigger points also for some patients, right? If they come across a similar experience, it might trigger another episode. You never know.
Yes,
I've heard about a lot of times, like, people, especially if they've not healed 100%, although they assume that they've healed, if one particular incident, which they might have completely thought they've forgotten, if it's coming back in their life, it completely, reignites the whole thing, whatever they went through, and it's the same episode all over again. I don't know. It's just that my research has told me that, and I could be completely wrong here.
you're right. So there are trigger points. There are relapses is definitely in substance use dependence, or whatever, whatever we call it, substance dependence. Similarly, mental health issues which are a part of it, and again how one needs to support. So
Mm-hmm.
it's a continuous process for a very chronic, difficult condition. And of course, today we're talking about dependence on our devices, our mobiles, which
Yes.
is as difficult as having alcohol or tobacco. Or,
It's
there's so much
addiction, exactly. Yes, there's a lot of trigger point. People are like so obsessed with their mobile devices and spend like vast majority of their time during the day on social media, and they consume a lot of different information, which
that's right.
might be good for them and might not be good for them. You never know, depending on the kind of information they chose to view.
Absolutely. So, so it's all sort of tied up with wellness, well-being, ups and downs. And therefore, it would fascinate how families are impacted, children are impacted, the local community is impacted. At the same time, they can offer support. You
True.
see, that's the important thing, that one works not just with the client or the index patient, to use a very clinical word, but there are others, who are struggling with uh, with some kind of an issue. It's impacted, so it sort of disperses into a community, and therefore one needs to work, and being trained in social work, casework, group work, it's very helpful to use these methods. Community organization, these are some of the papers that we did, and to see it all coming alive is quite gratifying. So that's one thing. And then looking at you said arts
Yeah.
based.
Yes. Yes.
It's quite fascinating because here's the thing, like you rightly said, not everybody speaks about distress, but maybe I can articulate or heal through a column or a
Mm-hmm.
rangoli,
Yes.
and or maybe a story that you tell me and I identify with the character.
Yeah.
I join you in the story, and then you give me some ideas of how I can find a path to
Mm-hmm.
recover or heal. And so storytelling, visual art, drumming, the use of rhythm and music, which India is so blessed with in
Yes.
different forms. All these help the person or the client who's in distress to come out, either one to one or in a group. And, I can communicate because I have the options. I can just sit, which is
Yes.
also fine. So, therefore, this multimodal expressive, uh, you know, intervention is always, I feel not much is done, sadly, because we say, oh, there's not enough of scientific evidence, so called scientific evidence, and therefore it's not sort of used enough. But again, at the Banyan, I think I was able to, do a course and then see how powerful it is, especially with the people struggling with severe mental health conditions like psychosis, mood disorders, or just, not wanting to speak,
Mm-hmm. Understood.
aphasia, amotivation, and from different parts. So, what is a language then? The language is multimedia, arts, which includes different forms. So, I can sit in the group because while I don't want to speak, I have different options. You see,
So
so
you're
that
you're basically choosing different modalities depending on what resonates with that particular individual, whatever they're going through. Like you rightfully said, right? Some person may be able to express what they're going through in a form of column, which is something which is very gratifying for them, and maybe that relieves their stress, whatever they're going through. But identifying what connects with them is the most difficult part. So that's where having that kind of patience, you said, right, simply listening to them and going through the entire journey and then figuring it out, oh, this is that modality which connects them, or something which heals them. So then train them in that aspect so that they can completely come out of it. I love it the way you're saying it, because using art in a way that and now you're not giving like a cookie cutter recipe for there's one this is one form of art we're going to use for this person. It's like person by person, depending on what connects to them.
absolutely. So you're bringing in an element of playfulness.
Yes, yes, yeah, absolutely,
I
yes.
forget, while it's about, it seems like a very grim, which is so, there's also sparks of playfulness, a sense of joy. And I can even if I don't participate, Preetha, when I see you doing it, I'm saying, oh, wow, she's doing it.
Yes,
I
yes.
may connect. Or I might say, okay, there are many options and I can choose something. Well, it's not easy, but of course, with some training, we're able to. And I think, I really love it when people come alive when you play MGR songs,
Yes.
Jayalalitha, or a Ilayaraja or a Rahman. Everyone's like, yes, and they start moving. So you have a therapeutic goal, and then you have this modality, and you just see people getting out of their chairs, waking up, and just joining, and
Uh,
it's just
You're bringing
wow.
up a very interesting point. I read recently in an article about music, and I'm a huge, music lover. I'm sure everybody in this world is. We all have our favorite genre, and we listen to what we like. And there are certain music we have for different moods of the day and things like that. And one of the things what they said was like each musical note has a frequency or a vibration, and depending on where you are in your own ascension of growth, you are in a certain frequency. So there are certain music which will invoke joy in you, and some will some frequency will invoke a different kind of emotion, depending on whatever state of mind you are in and what level you are. And so some may not like hard rock music. Some people don't like it because that's a totally different frequency, versus someone only like completely country music. Like for instance, you said like some people love Ilayaraja. We all grew up listening to Ilayaraja's music. Some people, maybe the current generation may not resonate with it because that's not the frequency they grew up with. They may like the newer music directors, but that's okay. But that's the level. But identifying that, and And they were saying about this music therapy and how each, I can go a little deeper by saying how the chakras can be completely balanced by different frequency of the music. I was so amazed. And there are so many organizations around the world, especially in India. If you go through the Varanasi area, there are so many centers which actually do music therapy for you to cure certain ailments in your body. So when you actually said that, it's just resonating with me a lot. Using art form, music is another art form. How do you connect with that individual? What connects with them? That's brilliant.
Absolutely. And like, for example, you'll have somebody. So we do this, we also have sing-alongs.
Okay.
I'm organizing because it's like everyone just comes alive, or they're just engaging, sitting, listening. So there could be, so usually we something like, I don't know whether you remember, Ado Anda Paravai Pola,
Yes,
Ado
yes.
one, it's like a anthem. So there
Anthem,
are,
yes.
and then there's, they'll say, oh, Poda, the modern,
Modern song, yeah, yeah.
or they can be lungi dance. So then they start saying, I want to sing this. So then they start getting sort of stimulated, and then we have to really sometimes, say, hey, go easy a bit. So then we do it thematically. For example, Diwali tayathala, Deepavali tayathala, enna paatu paadininga. During Diwali, what are the songs you sang? What do you remember? So they remember their childhood, their families.
Wow. So now the good memories, it's invoking all the good memories. That's
And then they might
amazing.
say, "Oh, I lived here and, my mom did this." So they're able to sort of recall while they've been at our center for years, they're able to connect or, somebody would draw a river and a tree. And this is how I celebrated Pongal, or this is what I did, for Holi. So they're able to, and festivals, as you know, is a lot.
Yes, it's a,
Something, oh, for Christmas, what do you remember? So then they all talk about, somebody will share. So it also sort of brings in a lot of connection, memories, sharing. And then they're looking at, using whatever you like. You can pick up a paper. So what we do is we get them to also do it as a group activity, saying, can we work in twos, in pairs, something that they may not do or sort of communicate so much in verbal media, but when you use this, there's a sense of connection.
yes.
And here's the thing, Preetha, what is amazing is, see, there's always a goal. You might say, to improve concentration, to strengthen focus for an hour,
Hmm.
or build teamwork. So they sit for 1 hour, and it's a lot when
It
we
is a
have.
lot, the collaboration, the camaraderie. You're teaching them the skills which they might have forgotten along the way. And how do you reinvoke and tell them, like, show them the discipline of focusing in one task for an hour and show
Yes,
them that you actually can collaborate and work rather than being isolated, or you can actually work with another individual and show them how to do it. And
yes,
slowly but steadily, like you said, right? Like 1 hour, it's a lot for them, but we may think, oh, it's only but for them it is. People who are going through that kind of a distress, they only know what they're going through. But doing it in a form where they don't understand that they're in this a classroom setting, or in a discipline setting, like using the art form, which is much more relaxed. Like for music instead, like you said, right? Like when MGR song is being played, it's like it's invoking a totally different kind of an emotion. They forget where they are, and they are like completely in a jubilant mode, and they want to dance to it, and they want to connect with the kind of memories what resonates with that particular song. It can be a childhood incident, or some kind of a celebration in their life. It's beautiful.
sometimes you might have a client saying, who will burst into a Bengali song, you know
Wow.
his song. And it's not just music, so we use different media. So it could be, for example, using colors, movement. So it's a multimedia format in that 1 hour. Of course, it's already pre-planned. I mean, there's some
Hmm.
amount of prep work, and we sit maybe, maybe about 15 people. And as you continue to do it, you find that people come and they stay and they sort of engage, you know
Understand. Oh,
anyway.
that's a very brilliant way, and I'm so intrigued just listening to it. I can only imagine how it is. Like you said, right? It's not like one size fits all. You have to personalize this approach for every single client, and got to figure out what resonates with them, and that's a huge task in itself. And doing that is
Yes.
amazing. It's
And here's the Preetha, for me, one of the virtues in art-based therapy is I require patience and
Yes,
be able to improvise. While I'm planned, things can go completely haywire.
true.
Okay.
Very true. Yes.
The challenge is on me to just be in the here and now, to be patient and learn to improvise and accept what happens.
Yeah, you can't just go assuming that this is going to be the final outcome. It can be anything. So, like you said, patience is a virtue here. You just have to. You can wish for the best and go with the flow. And whatever it might be the outcome, it's okay. You're going to accept it. Maybe that is a huge lesson for you to fine tune what you need to do on the next approach. And so, I guess you as a person implementing this is also learning a totally different approach, like patience, you said, right? It's very important in this realm of work. Amazing. So the next I have is like challenges and rewards. You like, this is amazing that 20 plus years of life in this field, I'm sure you have had your own challenges and rewards. Like, working in mental health can be both profoundly challenging and rewarding. Could you describe one of the most challenging projects or situations you've faced in your role at BALM? And on the flip side, what has been one of the most rewarding outcomes from your work?
I think I'd like to talk about the rewarding aspect. Is that I think first, I think Banyan believes that everybody can be trained. That we're all eligible, and I like the deconstruction of making it work in the local language, whether it's Tamil or Malayalam or Kannada or Hindi. That we're moving away from English, and for me that is a challenge because of my, if I may use a word, my colonial education. And I realize that if I don't speak, if I don't read a bit, if I don't write, I'm not effective. You see, and
Understood. Yes, yes.
that for me is very important. And so we do. So the challenge is that for me is an important learning, and therefore I have to push it. And also I understand that it's not easy because I think training, for example, we do a lot of training, and so if can I pause a minute?
Yes,
Just,
absolutely. Yeah, sure.
just like this. Okay.
Yeah.
So one of the so the rewards is when you see the sense of how, for example, since we're involved in training,
Hmm.
how there is some kind of response to the training, people are using it. You see, I mean, I think, and in the context of the Banyan, whatever we do, has to ideally be impactful.
Hmm. Yes,
Impactful,
absolutely.
impactful the client, the community, and so on. And I
Hmm.
think that is something I have learned, which is very rewarding. And I have to push myself because, like I said, the challenge is, use it in, pedagogy, which is very practical, on the ground, local languages, and, mainly applicable, Preetha,
Hmm.
to
Yeah.
be, has to ideally work. And then we try to scale it up. So I think that for me is always a learning process.
Awesome. So I recall you also talking about, like, the first responders is something that you're working right now with the peer-to-peer connection, the first responders, especially now you're also identifying the LGBT community. Can you please elaborate on that as well? I'd like to understand, because you said that's more rewarding, right? I think that's a huge rewarding experience. I'd like to hear more about that as well.
Yeah, so we developed a manual which came as a sort of a request from an organization in Bangalore which works with the LGBTQI
Okay.
in the community, and we so they had a helpline, and they found that people don't easily pick up the phone and speak to the trained counselors or the psychologist or the psychiatrist, but they speak to each other. So, for example, if I'm beaten up by the police, or there's a lot of partner violence,
Hmm.
and or while I'm doing sex work, there is some kind of a situation, I would immediately speak with my friend,
Hmm.
okay, from my community, and who would ideally sort of resolve it, help me manage the problem, and so on. And when things escalate, they would call the helpline.
Understood. Okay.
So that was a learning for us. So we helped them to understand this. So then they said, hey, can we train the peers? So we said, okay, we'll try. So we put something on like a mental health aid,
Okay.
like we called it the first responders, and they're the first point of contact to help the person in distress. So we developed a manual, uh, ideally for the community. And here's the thing, we also started using it in the context of the Banyan, where we found that, community healthcare workers
Okay.
can be empowered because they're the first point of contact. And then the beauty is there is a referral network. So then you escalate it, you say, hey, you got to see this person. There's a health center, go to the clinic, there's an outpatient clinic. But it's not like people go straight there. There are different levels,
Got
you
it.
see? Yeah.
That's amazing. That's really nice to identify, the peer who that particular client can resonate with versus
Yes.
coming directly and asking for help. That's amazing.
Client it could also be, different healthcare workers who may have definitely a rapport. They go on home visits, and then so they immediately identify signs of, say for example, early signs of depression or anxiety, or you call them common mental health disorders, risk factors. Hey, I'm drinking a lot, and there's sort of alcohol, abuse, or there's violence, or somebody could be, in different situations, and then you might just say, hey, this seems like a red flag. I may have symptoms of suicide. It seems like a red flag. And then you're able to then help the person with some life skills. And then, so you're parallelly, you're also watching out for flags. And then you might say, hey, you know what, I think, let's go and meet this person. So we have been training our community health workers, including, some peers, and in on I think 1st of June, we're planning to share this training manual as an open source.
So to everybody, whoever wants to, gain access to it, it's available as an open source, so which they can utilize for their own organization. That's amazing. That's a wealth of information and tools that you're making available for people who are in need of such interventions. Oh, that's amazing.
And so we also prepared training videos in Tamil and Kannada,
Okay.
in non-actors, which was fantastic. So people from the community acted.
Okay,
You see?
so it's not like professionals or anything. They're like, these are like individuals who are actually on the ground working day in and day out. So it resonates with
Yes.
everybody. Oh
And we
my God.
brought in some case studies. We shot it at BALM, and so we made it. Well, I mean, it's the way it is. This
Yeah,
is so it was very realistic. So we had a script. So this will be available, and we're saying, this is important. People should be able to use it. You see?
very nice, amazing, beautiful. So the next question I have is like, I think it's a perfect segue as well, because now you said this particular tool is going to be available for open source. So all organizations who are looking for such tools, it's going to be available. Similarly, I'm sure you have developed different models at BALM over the years. Especially BALM is known for its innovative approaches to mental health care. So, how do you integrate your research and personal practice into these models? Like, can you discuss on how these approaches have been developed and the impact they've had on the communities you serve?
So, I mean, to put it very simply, for example, um, the first responders, we did a pilot.
Okay,
So, I mean, what was fascinating for us is we co-created it with the community, with the peers who are already counseling, who are already serving as first responders before the manual. And we say, do you think this will work? And we also sort of use some evidence from life skills manuals. And so we sort of test it,
okay.
and we do a pilot test. We've done this and said, what do you think we can drop? How does this work? So in a way, it's, if I may use the word, it's multidisciplinary.
Okay.
And it's not about, I'm the expert or we are the experts, but you are the expert. You're going to use this. So tell us, how is this going to work? What are the stories? And,
Ah,
and in a very real way, it could be case studies from the LGBTQI. It could be somebody from the Banyan community, someone who is elderly, who's struggling. So let's work on the stories. So it's embedded where you test it and then you let it sort of, so, and then we're also planning to review this. So
Wonderful. Oh,
it's a bit slow, but that's really okay because we just, and we've also sort of used this in a healthcare setting where they dialyze patients who have kidney issues for, who are on dialysis for life. So we also discovered that the nurse or the hospital attendant who's doing the job hears a lot of stories of, trouble, and they don't know what to do with the knowledge.
yeah.
So they say, can you train us to be first responders?
Understood. So,
Mm.
getting all these information from different sources, how do you, make sure that your respond to it is more structured versus chaotic? So you're
Yes.
actually, training them the right way to approach versus, not going with your external circumstances or your surroundings, but you know exactly how to approach that, irrespective of what information is fed to them.
Do some review based, review of literature to see what are the techniques that work. We've showed them the friendship bench, which was
Okay.
a mark intervention recognized by the WHO. So
Oh,
we
beautiful. Very nice. Okay.
draw from it and say, okay, now let's work on this manual that works for us, something like that.
Wonderful. Very nice.
And then we're just trying different things.
Beautiful. I just love the way that you are making sure that it's a collaborative thing rather than you're coming with, theory based, strategies. You're making sure that it's collaborative. You're asking them what works. So I think that's why Banyan is very successful in creating these models as well, because it's more inclusive. So I have the last question for you, the vision for the future. So, looking ahead, what are your aspirations for the future of mental health care, both in your work at BALM and in the broader field? How do you see your current research influencing these developments?
I think the important thing, I think, and of course we keep looking at it as uh, important vision is to train peers, peer advocates, people who have been in distress, who may have ups and downs. They're all part of the team.
Yes.
That's our vision, that we sort of blur the lines of us and them. But we work in a very real way. I mean, all the courses that we run, we train, we ensure that there are people who are from the community. I think that's the vision, to sort of then, let it trickle.
Mm-hmm.
And, we work across levels, and sort of from the community and up, something like that. So because we're
Something.
all involved in policies and so on, but it's about what is on the ground. And I think that's the vision. While it's very challenging, that helps in the context of public health in a country like India. There's no other way.
Yeah, okay, understood. So the ground up and blurring the line and making sure it's more of an inclusive approach. I love that. And I'm sure Banyan will be able to do it with individuals like you. Like I said, even before the interview started, um, with the individuals I've interviewed thus far from Banyan, I'm simply amazed at the kind of work, what you guys do. And God bless you all for doing such amazing work, because this world needs more people like you. So I am so, so excited today that I had this beautiful opportunity to have a conversation with you, Dr. Lakshmi. Thank you for sharing your profound insights and enriching our understanding of mental health practices today. Your dedication to advancing mental care through innovative, compassionate approaches is truly inspiring, especially the art based. I'm like completely in awe of that. And to our listeners, we hope today's conversation has illuminated the complex yet vital world of mental health and the transformative work being done at BALM. So, as parting ways, Dr. Lakshmi, do you have anything that you would like to say to the audience before we say goodbye?
So I was just thinking when you said, art based. I think, Preetha, here it's all about, I like the word support circles. You
Okay,
know,
beautiful. Okay.
clarity, and rather than a line, having the sort of organic circles in the community is something I would like to tell everybody. Just sitting together and doing something is the magic.
Think you're right. This day and age, I think people are looking for the companionship is more important. People, somebody to talk to, just listen to them without any judgment and just to hear them out. I was recently looking at an ad which was, which randomly came to my feed on Instagram, where people pay you just for listening to them for 1 hour, and that's become a business. And I was like wondering, where has this world gone right now, that people are requesting for someone's time? Just give me 1 hour of your time, just listen to me. And they're willing to even to speak to strangers. That's it. They don't want any family members or friends or relatives. They just need somebody to spend some time. And I think when this in this crazy world where people are all running after so many things, not even knowing where they are, but they fail to actually interact with one another. They're very busy with behind their gadgets, or running behind their businesses and other modes of employment, or any other things, whatever they do. But they don't find time to sit with their dear and near ones to communicate. And I guess that's another epidemic that's happening in this world. So to what you said is rightfully, having that conversation, that art form, what you said, right? Like just to listen to them and sit with them and resonate with what is that particular modality that resonates with that individual, which can cure them, is extremely important. So I think that is a big takeaway for me today from this conversation, to connect with another individual. So thank you for tuning in to Planet Forward with Preetha, conversations for a greener future. Join us next time as we continue to explore stories of resilience, innovation, and leadership in sustainability. Until then, remember, the journey to change starts with awareness, and each step forward makes a difference. Goodbye and take care.
Thank you for tuning in to the Planet Forward with Preetha, conversations for a greener future. Together, we're exploring the innovations and stories that inspire us to think and act for a sustainable world. If you're inspired by today's conversation and want to be part of this journey toward a greener future, make sure to subscribe to our podcast on your favorite platform. By subscribing, you'll never miss an episode filled with groundbreaking ideas and actionable solutions. Let's continue to make a difference, one episode at a time. I'm Preetha, reminding you to make every day count for our planet. Until next time, keep moving the planet forward.